Welcome, I'm Dr. Kate.
And aloha, I'm Dr. Nima. So today we're going to be talking about meniscus tears and how we can manage them non-operatively. We're pretty excited today because we have special guests, the prehab guys. We have Arash to my left and Mike to my right. The prehab guys have changed the physical therapy game by bringing physical therapy into your home through your handheld device.
Let's first talk about what is a meniscus.
So a meniscus, let me grab my trusty knee over here, is the C-shaped tissue between the thigh bone and the shin bone.
What is the function of that C-shaped structure?
So that's a great question. The function of the tissue is basically it's a shock absorber. It's managing the load and the force transmission that's going from the thigh bone into the shin bone.
Cool. And what are symptoms of a meniscus tear if you were to have one?
So the most common symptom is pain. Most athletes or people who are active or whatnot are getting pain right around the joint line, which is in between the two bones. But they can also get clicking, catching, and locking.
Wow, okay. And do all of these tears need surgery?
That is a great question. This is actually a topic that comes up a lot. And the truth is, not all meniscus tears need surgery. You only need surgery if you're having mechanical symptoms such as that clicking, catching, and locking. So locking, for example, would be if you tore a piece of the tissue and it actually flipped over and it blocked you from straightening your leg. That's a serious issue and you need to see a surgeon to basically take away that mechanical obstruction. But the majority of meniscus tears can be treated with conservative treatment. That includes anti-inflammatories, ice, possibly injections, and especially physical therapy to strengthen the leg and ideally even avoid future injuries. So Mike, Rash, what things can we do to treat meniscus tears?
So we're going to go over some exercises to treat some meniscus tears, but before we do that, we need to identify what are the things that cause us to have pain when we have them. A lot of times, like Nima said, it's load. So say you go for a 5-mile walk with your kids or your friends, and at mile 4 your knee starts to hurt. Well, temporarily, you're going to have to decrease how much mileage you do. You only walk 3 miles, and then build yourself back up to doing more. The second thing is how deep you go in a squat, on a stair, on a lunge, any sort of leg exercise. The deeper you go, the more compressive forces there are on that meniscus, so you may have to minimize how deep you go. You may not have to be able to squat all the way to the bottom anymore, and you may have to do partial squats just for the time being until you get your legs stronger. When it comes to the muscles that we want to work your quadriceps, the hamstrings in the back, and the glutes. And we're going to go over 3 exercises right now that do all that. So the first
Mike, just real quick, that's a really great point. What Mike's talking about is when you get too low, there are certain patients that say that they feel comfortable until they get really low. So just remember, just go as low as you can go. You don't have to have your butt touch the ground every time you do a squat.
Yeah, and it will get better in time. You know, I think we were talking earlier about how many people actually have meniscus tears that don't have symptoms, right?
Oh, that's another good point. There are actually several studies that show that even in professional athletes, a large percent of them have asymptomatic meniscus tears. So just because your MRI reads that you have a tear doesn't always mean you need surgery. There are other options and you should always do those first. And if those fail, then surgery can be an option.
So let's do this. We'll show the straight leg raise exercise first.
Kate?
I think you're going this time. Yeah.
Oh boy.
You want me to take the knee?
Sorry, ladies and gentlemen.
So the straight leg raise, the goal of it is to work your quadricep muscle, which is the one in front. You're going to lie on your back. For this example, we're going to be working the left leg. So you can bend this one first. Step 1, make sure your stomach muscles are engaged a little bit. Step 2, the most important part before you do anything is you have to squeeze your thigh as hard as you can. Think about straightening your leg and getting it as long as it can. Once you have that contraction and you squeeze, you keep it squeezed as hard as you're able to and slowly begin to lift it.
You impressed with my strength, Mike?
I am. Lift it. Go. And then you slowly lower. The key is that you have to feel it through here. A lot of times people just feel their hip, and it's because they're not squeezing this hard enough. They squeeze it, and then when they lift, they forget to squeeze it.
Yeah.
They let go.
I do that.
So you have to keep the squeeze 100% the entire time and lift, and then slowly lower. If this ever gets easy for you, you can put ankle weights on their ankle.
Perfect.
You may have developed a hernia from that one.
Cool. Another exercise you can do is a double leg bridge, where what Nima's going to do is actually bend the left knee. So both his feet are going to be equal here, and he's going to drive in with his heels. The heels are going to get the back of the legs, the hamstrings and the glutes here. So he's going to drive in with the heels as he tries to lift the hips up towards the sky. So Nima, go ahead and try to squeeze your glutes as you come up, And what you want to focus on is driving with the glutes. You want to avoid using those low back muscles.
So I'm doing that wrong. I definitely felt the lower back.
Lower back, okay. So what you want to focus on first is driving in with the heels. Squeeze the glute a little bit here. And as you come up, you want to focus on driving that motion with the hips.
Oh, yeah.
So the back will arch if you're using the back muscles. You want to focus on moving at the hips. Good, squeeze the glutes. I feel that here. If you want to, you can put your hands on your butt just to give yourself a little tactile cue to make sure that you're activating there.
It's all glutes now for sure.
There we go, good. And then slowly come back down. And then what you can do if you want to challenge yourself a little bit more, if this was too easy for you, is you can lift one leg up. You can bring one leg up, either straight or towards your chest. And then you're going to focus on driving in with the heel on the left leg here. And then bringing the same thing. Bring the hips up towards the sky. Yep.
There we go.
This is the challenge here.
Feel the
so
burn.
work within your tolerance. Like Mike was saying, what you want to focus on, you can come back down. Is basically
Still shaking.
Still shaking. Good. So that's a progression. But basically, this is going to strengthen the muscles around the knees to help support the knee a little bit.
Let's have some fun right now with Nemo. We're going to combine those two exercises into one. So when he's on his back, the first exercise he's going to do the straight leg raise first. So he's going to squeeze, hold it up, hold. Now you're going to hold that there, and now you're going to do your bridge on this side. Bridge, good.
Oh.
Now lower,
This is a 2-for-1 right here.
And then lower. So now you're hitting both of them at the same time. So if you want to combine them and save some time because you only have a couple minutes to do your rehab every day, you can put both of them together like that.
That's way harder than it looks, folks.
All right, the third one we're going to do is called side steps. So like we talked about in the squat, the deeper you go, the more compression there is. And if it's symptomatic, meaning it hurts, then you don't need to go as low and you can go this height. So on normal squats, normal lunges, you can limit your range. But for side steps in general, you can start without a band first. You're going to hold like a mini squat position, and you're just going to be stepping out to the side. Okay. The key is that as I go to my right, I'm not just trying to walk to my right, which is very easy. You're trying to push through your other hip and let yourself drive this hip into the ground. Now when I go this way, I'm going to use my right leg, and I'm going to be using my right glute and butt to push out. To make that harder, we can use a band. We can use a band. Band placement, I would start above the knees. You could go ankles and toes. Knees is going to be easier to start with. What's nice about bands is it gives you cues to push out. So just having the band on, it already turns on your butt muscles because the band's trying to push you in and you're trying to push out and resist it. So once you feel comfortable in this position, you can start taking slow steps to your left, really driving through your hip. Good. And then now towards me.
Oh, yeah, I'm feeling this.
So it's always your back leg that you should feel working.
Trying to get in shape for my honey.
And again, say if this hurt, if you had a little meniscus irritation here, you can just stand up a little taller and not go as deep.
That makes perfect sense.
Cool. Awesome. How you feel?
Oh, I'm a little bit sore, to be honest. So, guys, how many reps should we be doing of this?
So I would say you can give yourself a number to start with, 10, 15. But ideally, you want to work until you're fatigued because you need to make sure the exercise is hard enough so it's actually having changes and you're actually getting stronger. Because if you're underloading yourself, you can do this. It can be a cakewalk.
So thank you guys so much, Mike and Arash, for being here. Again, check out the prehab, guys. This was really helpful. I have a lot of friends, mostly their husbands, who have had meniscus tears, and hopefully this video will help all of them do some of their exercises at home.
And don't forget to check them out on their own YouTube channel, The Prehab Guys, as well as on Instagram at The Prehab Guys.
Thanks for having us.
Thanks for having us.
Thank you, guys. Take care. Click to subscribe below.
Don't forget to like and comment. Your comments can guide us on what videos we make next.